Welcome to Living Well. We are so happy that you joined us today. We have a very important program that we're going to talk about taking time to optimize your health. You know, sometimes when people make lifestyle changes, it's really difficult because it doesn't work as fast as some medicines do. And so what we want to talk about today is how do you make lifestyle changes that will optimize your health, your mind, your body, and spirit so that you feel energized. And so today our speaker is Emilyn Mark, and she's going to share with you some secrets about how to optimize your health so that you will feel well and function well. I do want to tell you that we do not assess, treat, diagnose any type of conditions on this program. It's mainly for educational purposes. So you will hear scriptures, you'll hear personal testimonies, you'll hear references to research, but we will not diagnose. This is only for educational purposes only, but we're so very happy that you have joined us today. And so I'm going to turn it over to Emilyn because she's going to share with you some really important information. If you have questions, feel free to put them in the chat box, or once we open the mic, we invite you to ask your questions. You may want to get a piece of paper, pencil, take some notes, because what she's going to share today are simple, effective ways to optimize your health. Welcome, Emilyn.
Thank you, Dr. Sankey. I am so glad to be here today. The topic is very important, taking time to optimize your health. In today's busy society, many of us do not take time to evaluate our health status. We rely on conventional medicine to fix our problem when we are not feeling well. Although conventional medicine has come a long way in prolonging lives, it still has its own drawback. According to research since 1950, the average lifespan or expectancy has increased by over 10 years in the United States and 30 years globally. Due to the progress and advancement in medicine and screening protocols, threatening lifelong illnesses are detected and treated sooner, thus reducing the death toll. Therefore, people are living longer. People are living like into their 70s and 80s, and may I even say 90s? While working in the hospital, I have taken care of patients who were 100 to 100 plus and still looking good. This was unheard of, people living this long, before medication like antibiotics, X-rays like X-ray technology like CAT scans and MRI machines were around, even procedures like heart catheterization and other modern technologies. People were not living as long. Even though these medical treatments and technology can expand our lifespan, we are still living with lifelong chronic diseases. You see, conventional medicine only focuses on quantity of years you can live and not quality of life while living longer. Medicine today relies on pharmaceuticals to reduce your condition and only treat your symptoms and avoid looking for the root cause of ailments. In the book, 8 Weeks to Optimize Health, Dr. Andrew Weil discussed 3 case studies that he successfully treated with diet, herbs, and exercise. He was able to control the pain, for example, of a 60-plus-year-old woman who was suffering from restricted osteoarthritis without using NSAIDs. That's the medication that you get for arthritis. What he did, he recommended that she stay away from vegetable oils and fats, animal fats. Encourage her to use, instead of the vegetable oils, to use olive oil instead. And he supplemented the NSAID. He used evening primrose oil. And he encouraged her to use fewer animal products and use more whole grain and fresh vegetables. He also added 2 spices to her regimen, which were ginger and turmeric. Within 8 weeks, her pain was gone, and she did not have to rely on NSAIDs anymore. Case number 2, this was a healthy 36-year-old lawyer whose chief complaint was acid reflux. He started taking over-the-counter antacids, but without relief. So he went to seek help from Dr. Wiles. After seeing Dr. Wiles for 8 weeks and following his recommendation of giving up coffee and making better choices, not eating out so much at restaurants, breathing exercises, and not to engage in non-competitive sports, to do more relaxation type of exercise. And he added licorice extract for his acid reflux. Eventually, this gentleman, this lawyer, was able to get off of his antacids just by following those regimens. And the third case study was a young man in his late 20s who had anxiety disorder. His anxiety was so out of control that it affected his work. Dr. Wiles recommended that he make some lifestyle adjustment. You see, this gentleman, he loved watching the news. And he was an internet computer programmer at his job. And I guess he just loved being on the computer. He was an internet addict. So Dr. Wiles encouraged him to, not to watch the news so often and to reduce his time on the internet. He also added tincture of passion flower for his anxiety and breathing exercises. Nevertheless, although it took 6 months for this young man to completely reduce his anxiety, within 8 weeks, he showed significant improvement, that he was able to go back to work and not feeling as anxious as he did before. So these therapeutics worked. Although the non-pharmaceutical medication took longer to work, the patients reported that they felt better. They did not suffer from the side effects that the pharmaceuticals can bring on. For example, the NSAIDs, those can cause stomach ulcer, which can even be deadly if you don't take care of those ulcers. Some people have upset stomach. So all those medications had side effects. Although the non-pharmaceutical took longer to work, these patients did not suffer from side effects and did not have the rebound effects the conventional medication posed. The reason for the patient's improvement. So why did these patients improve with these non-pharmaceutical medications? Well, from what Dr. Wiles' conclusion was the improvement was due to hemostasis, or balance the body achieved when on these natural medications. The body can work with things that are natural. The body understands what to do with it. When we put chemicals in the body, it puts stress on the body, and therefore the body gets confused and doesn't know how to work with that medication. It will eventually help because there are certain chemicals in there that they put in there to help the patient, but it puts stress on the body. The human body likes to stay in hemostasis, meaning it likes to stay in balance. For example, the case of the lady who had arthritis, whenever she stopped taking those NSAIDs, the pain medication for arthritis, her pain will increase. We call that rebounding. Her pain will increase whenever she stopped taking the medication. This was because while taking the medication, the body was producing more inflammation. It was promoting a hormone called prostaglandins, and this was causing her to have more inflammation. Because you see what happened, the body's trying to balance itself, trying to stay in hemostasis. So taking this medication was like a force coming from the outside into her body. So the body realized, okay, this is powerful coming in. I need to increase and work harder so I can combat and stay in balance. So now prostaglandins increase the production of inflammation. So now she's having more inflammation because it's trying to stay in balance. And that is what was causing her problem. So when she stopped taking the medication, there was so much inflammation that she was having more problem. So once she started on the natural medication, like on her Primrose, the body was able to work with it. So while the natural method worked better because the anti-inflammatory hormone increased gradually, it wasn't this big rush, it increased gradually, thus allowing her body to gradually come into balance and not producing an overproduction of prostaglandins. Dr. Wild said, when you change hormonal balance gradually by changing your diet, you do not disturb the body's hemostasis, and you do not have to contend with rebounding symptoms. Another reason why these natural treatments work for these individuals, according to Dr. Wild, is the placebo effect, the mind-body connection. Now, I'm not saying that if you're sick, you just sit at home and think, for example, if you have cancer, that the tumor will disappear or the tumor will shrink, or if you have cholesterol, your cholesterol level will go down if you really think hard. It is more than positive thinking. It's about creating a stronger connection between the brain and the body and how they work. Dr. Ted Kapchuk, a Harvard medical, from the Harvard Medical Center. Science has found that under the right circumstances, a placebo can be just as effective as traditional treatments. PET scan has shown that there are parts of the brain that are energized in association with the placebo response. I want to believe that Jesus used a placebo response when he told the woman with the issue of blood who pursued him when she was trying to get his attention, that he said, "Your faith has made you whole." I believe that woman had a placebo response. she believed. She made changes so that she can maintain a whole, healthy. Changing old habits are difficult, but it can be done. To change old habits require determination and motivation. So another thing that we have to do in order for us to stay healthy, we have to change habits. Although it's difficult, but it can be done. Because what we need, determination and motivation. Research of a small research done in 2009 and was published in the Europe Journal of Psychology concluded that it takes 18 to 254 days to alter a habit. When you're trying to change a behavior related to nutrition, eating, drinking, or exercise, they found that it took 18 to 254 days for this group to change their nutritional habits and their drinking habits and the exercise habits. So change takes time. It is a gradual process. And as we noticed from the various cases that I mentioned before, it took the participants from 8 weeks to as long as 6 months to achieve healing. So what I'm trying to say is, do not give up. When you start a natural, healthy, nutritional diet, or I shouldn't say diet, but lifestyle, or you start using herbs, do not give up. It will not happen quickly. The changes might not come quickly. They might be gradual changes. So just be patient. Do not give up. Now, I have talked before about foods that can cause inflammation. So we have to be careful of what we put into our bodies because that can cause inflammation. Inflammation is known to be one of the main reasons for diseases. It's like the building block for all sorts of diseases. So if we can keep inflammation down in our bodies, then we will be much healthier. I know I've talked before about sugar. Refined sugar, such as that you find in sodas, juice, these desserts, it triggers the release of proteins that are in the body called cytokines. Now, cytokines respond to inflammation. Now, lots of cytokines in the body can cause inflammation. In addition to sugar, table sugar, I just want to add here fructose corn syrup. Fructose corn syrup, sucrose or maltose. Look at your what you call it. Look at your ingredients. Look at your ingredients and make sure that when you buying these things, you are not buying things that have all the sugar in it. Fructose corn syrup. Sometimes they change the name from sugar and they have maltose, and anything that ends with a toast is a form of sugar. So according to the Arthritis Health, they want us to stay away from this inflammatory food like sugar. If you suffer from a sweet tooth, and sometimes you want something sweet, go with a fruit. Although you might say fruit has fructose in it. Yes, but there's a fiber. It's different. There's a fiber in it that slows down the absorption of that sugar. Something like dates, nuts, something, try to eat something else besides sugar, fruits, vegetables. All of these foods contain what we call phytochemicals that reduce or slow down, that reduce inflammation. They are anti-inflammatory foods. Another one that we need to stay away from is refined carbohydrates. White rice, pasta, bread, potatoes, all are refined carbs and should be avoided if possible to prevent inflammation. Except for rice, these foods have in common gluten. Wheat-based flour are one of the most common ingredients used to make bread, pasta, and other carb-rich foods. And gluten is a natural component in wheat. But if you really are sensitive to gluten, then you should stay away from any type of gluten, because food sensitivity can increase inflammation. Another food to stay away from is red meat. These foods are high in saturated fats, and saturated fats are known to cause high cholesterol and inflammation. Red meat contains omega-6. Omega-6 is a highly inflammatory fat. So if you have too much of this omega-6 and not enough omega-3, it's imbalance, and you can start getting more pains and aches because of inflammations. These foods are pro-inflammatory foods. And when patients eat these foods, they can further perpetuate the cycle of inflammation. Alcohol is another thing we need to stay away from. Alcohol, severe gout. Gout is a common form of inflammation. Arthritis that is very painful. There are times when the symptoms can get worse, gout, because of something we ate and it flares up and cause more inflammation. So alcohol is something we need to stay away from. Fried foods and processed foods. When we fry our food, we destroy the valuable nutrients in these foods. And these fats, especially when you barbecuing meat, the heat and the fat, the oil, the grease, the fat can have a carcinogenic effect. According to the Rheumatology Center of New Jersey, it's saying that frying these foods, food that has fat in it, can increase cancer. Many foods that comes fried also contain a number of heavily processed ingredients like salt. All of these will cause inflammation by triggering the body's defense mechanism, which will set up for arthritis to flare up. So too much excess salt intake may lead to swelling and worsening of the arthritis symptoms. As I said, highly processed foods are something we need to stay away from because they can increase inflammation. Vegetable oils. I know we think that using vegetables, because the word vegetable is on there, that is good. But vegetable oils are high in omega-6. And as I just said before, omega-6 is one of the things we need to stay away from because it triggers inflammation. I'm sorry. So vegetable oils like canola oil, sunflower seed oil, grapeseed oil, all of those oils, vegetable oils, we need to be careful because it can cause inflammation. So now I've talked about some foods that can cause inflammation. So what can we eat? What are some of these foods that we can eat that are considered anti-inflammatory foods? Of course, fruits are one of our top things that we can eat, foods that we can eat, I should say. Blueberries, raspberry, those berries are full of antioxidants. The color you see how bright and colorful those berries are? Those berries, the red, blue, all those different colors, contain anti-inflammatory factors. They are beneficial for us to eat. So eat as much as you can of those, of blueberries, raspberries, strawberries. Those are good to eat. Pomegranate, good food, good fruits to eat. Now, spices. There are some spices that are very beneficial. The two spices that Dr. Wiles used on his patients, they were turmeric and ginger. Those ginger and turmeric are known for anti-inflammatory purpose. Garlic, it reduces interleukin 6, which is an anti-inflammatory immune response when you have inflammation. Ginger powder, of course, going plant-based diet, decrease inflammation, is considered anti-inflammatory. Fresh fruits and vegetables like avocados, peppers, broccoli, mushrooms, those are good anti-inflammatory fruits, dark green vegetables. And total elimination of animal products, the cheese, the milk, any animal product can set you up for inflammation. I just want to mention some more spices because as I was doing my research, I came across a whole slew of spices that we can use for different conditions. I did talk about turmeric. Turmeric has some anti-inflammatory, antioxidant, antibacterial, antiviral, and antiseptic benefits. All of those things from turmeric. Ginger is also a high antioxidant food. It's an anti-nausea if you have upset stomach. Is very good for that. Ginger, several controlled studies have proven that ginger is effective for upset stomach, nausea. Cumin. Cumin is beneficial for weight loss, cholesterol, stress management, and more. It's also very high antioxidant, has high antioxidant properties. Peppermint. Peppermint is also effective in improving cardiovascular, pulmonary, and acts as a bronchodilator. Bronchodilator works on the lungs to open up your airway. If you have problems breathing, it opens up your airway. So I use peppermint oil to help with breathing. I know I do an inhalation treatment where I put some peppermint oil in hot water and make a tent like a towel over my head and inhale that. And it's so refreshing. I feel my lungs open up. Sometimes I can even bring up secretions. So peppermint is good. I read somewhere where they talk about peppermint for, I know we like to use peppermint tea when we have upset stomach, but we have to be careful with peppermint when we have acid reflux problems because it relaxes that sphincter right where connection of the stomach and the esophagus is. It relaxes that sphincter, so therefore it opens it up and you can easily get that burning, that acid going back up into the esophagus. So be careful. If you have acid reflux, be careful with peppermint. Echinacea. Echinacea is a good supplement to help the immune system. It helps prevent colds and it boosts your immune system. Cinnamon is an antibacterial, antioxidant, anti-inflammatory, even helps with diabetes, anti-diabetic, and anti-carcinogenic spice. A 2015 review shows that cinnamon may reduce blood sugar levels. Chili powder. A 2015 research suggests that capsaicin, that's the substance in the chili powder, phytochemicals that makes chili powder spicy. It plays an important role in regulating the heart and metabolic health. Parsley. High is good for high blood pressure and allergies. Oregano helps strengthen the immune system against infection, reducing inflammation, regulating blood sugars, alleviating urinary tract symptoms, and also menstrual cramp, and help fight cancer. As I said before, I have an inhalation treatment that I do. I also put some oregano oil in that. So I put oregano oil, peppermint, and oregano oil, peppermint, and there are 3 oils I put in there: oregano, peppermint, and so I put those oils. I can't remember the 3rd oil, but I put it in this hot water and I'm able to inhale it. Did I say peppermint? Yeah. So that's a good treatment. If you find yourself stuffy, you can do that. Evening primrose was one of the treatments that Dr. Wiles used. And when I looked up about evening primrose, what I found, evening primrose has 2 to 15% of gamma linoleic acid, linoleic acid, which GLA, and that GLA is good for inflammation. So when he treated that lady with that primrose, it was able to reduce her inflammation. I also looked up licorice. That was one of the treatments he used for the gentleman who had acid reflux. And it helps relieve the symptoms of indigestion, such as reflux, acid reflux, upset stomach, and heartburn. A research was done on 50 adults with indigestion. They took 75 milligrams of licorice capsule twice daily. And within 30 days, they show significant improvement compared to the placebo group who did not take the licorice. They were able to reduce their acid reflux. Now, I need to caution you about licorice. Licorice can raise blood pressure. So if you have hypertension or any kind of cardiovascular issues, be careful. It can also reduce potassium and cause circulatory problems. So be careful with taking licorice. The passion flower tincture that the young man took who was suffering from anxiety, I looked that up and it says that passion fruit tincture can help with sleep, anxiety, and also insomnia, stress, and ADHD. So these are just some of the things that in nature that we can use to reduce ailments like blood pressure, like anxiety, like arthritis, inflammation. These are some of the things we can use. Now, I am not telling you to go out there and stop taking your medications and just go crazy on these things, on these herbs. I do not know what the what I should say, the dosage of these herbs are, but I encourage you, if you can find a doctor who is a holistic doctor, someone who believes in herbs and using these things to help to bring the body back into homeostasis. Seek these type of doctors out with and see how they can help you with some of your conditions. The goal is sticking with the plan till you achieve success. As I said before, these medications, these treatments, they do not work immediately. They take time. There's no quick fix. Conventional medication can cause a rebound effect and putting your body in balance, and sometimes making the condition even worse. As I said before, let me be clear, do not stop taking your prescription medications without the advice of your doctor. Some medications cannot be stopped abruptly. They have to be tapered off, so be careful. I do encourage you to take an active role in your health. Find a doctor who believes in holistic, treating the body as a whole, body, mind, and spirit. Someone who promotes the whole holistic approach. Exercise. You do not have to do vigorous exercise. Walking is a good form of exercise. If you walk 30 minutes a day, very good. Out in the sun. The sun is another good source of helping with inflammation. Going out and walk, keep active. And as the Bible says, in 1 John, 2 John, I should say, he wants us to be prosperous and he wants us to be healthy. God wants the best for us. Let us embrace those healthful practices so that we can bring our bodies into hemostasis and stay healthy. Our challenge for this week. Look at yourself. See where you need to make a change. Maybe you need to increase drinking more water. Maybe you need to increase exercise. Whatever it might be. Maybe you have aches and pains and you maybe want to try something that we talk about today. Look at yourself and see what you need to change. And this week, start making that change. Form a plan. When you have to make a change, you just cannot say, oh, I'm going to make a change and just going to happen. You need to think about it, formulate a plan, and have a schedule. Sometimes you have to write things down, do a checklist, whatever it might be. Start formalizing a plan to improve your health so that you can enjoy a healthful lifestyle. Thanks for listening. At this time, I'm going to see if there are any questions. Let me look in the chat here. You can put your question in the chat, or you can open your mic and ask your question, and we go from there. Any questions? Okay. Okay. I did not see any questions in the chat or anyone raising their hands.
Carol?
Yes. Judy?
Mm-hmm. Yeah, how are you doing?
I'm doing wonderful.
Listen, you touch on something which I had an experience with because I had acid reflux. Mm-hmm. And I used to at least once a day eat a peppermint. Mm-hmm. And after doing a lot of research, I came to realize the peppermint is what was part of what triggers my acid reflux. Mm-hmm. And I had to stop completely. Mm-hmm. Then I tried that peppermint oil and it activated my acid reflux again. So you are right.
Mhm.
The
Yes.
peppermint does a lot to your acid reflux.
Okay, that is, yes, because what happened, peppermint relaxes the sphincter muscle that's between, where the esophagus, that long pipe that comes and joined to your stomach.
Mm-hmm.
There's a ring there, a valve like that closes after the food gets into your stomach. It closes that off, so it separates the esophagus from the stomach, because in the stomach is very acid. So when you take peppermint, it relaxes that sphincter. Now it's relaxed, and then it can open up easily, and then that acid goes back up into the esophagus. Now, if you take peppermint is good, but so if you have acid reflux, you must take peppermint in a capsule form. If you take it in a capsule form, from what the research was saying, in a capsule form, you wouldn't have that problem. Because what happened when you take it in a liquid, or you take it in a tea or something like that, it goes down, it passes, and it goes through the esophagus and all of that. So it's already starts stimulating and causing that esophagus to relax and that sphincter to relax. But when we take it in a pill form, it doesn't affect the esophagus. When it starts dissolving when it gets into the stomach.
Oh, okay.
So that's why it will be a better. Yeah. So that's what I'm saying. If you can follow a doctor who has knowledge in holistic medicine, there are a lot of things, a lot of good things out there, but still we have to be careful taking them. Some of them does not work in combination with some conventional medications that we're taking. So you have to be careful. And some of them, if you have certain conditions, maybe you should not be taking it. So always do your research.
Yeah.
Do your research. Ask questions, and before you start doing anything serious like that.
Yeah.
Thanks for sharing that, Judy. Yeah.
Thank you, my dear.
Yeah. Okay, so at this time, I'm going to reach out for anyone who has maybe a prayer request. Let me stop. Anyone with a prayer request? Okay, so no prayer request. So I